The reason I'm here today is because I had an accident when I was 5 years old. My leg was shattered. I was 5. I was playing out in the street and a drunk driver came and hit me.
She was hit by a car when she was 5 years old and had some injury to the knee. She was placed in a body cast for a number of months. And then at the age of 11, probably because of some malalignment of the knee, underwent a surgical procedure, and she was placed in a cast again and had a fairly normal life after that until the knee started to become more painful and more deformed.
I was having terrible pains in my hip, in my left hip. Dr. Altchek had been sort of a friend of Roland, my husband's, and our family. In our eyes, it was the best place to go, so that's where we went.
I've known Lois for a long time as an incredibly cheerful, happy, active, healthy woman. When I met her first as a patient, I was a little surprised to see what a severe knee deformity she had.
Right before the operation, Dr. Altchek calls me and he says, "This is going to be a little more problematic than I thought, and I'm going to have you go with Dr. Buly, who is a specialist."
One of the great things about HSS is the depth of the bench here, and you know, I do knee replacement surgery routinely, and I do it well, and I was trained to do it, but I don't do deformity knee replacement surgery. And it's very important to understand when you are not able to provide the best care for a patient, and then to have that person that can right there at your fingertips is amazing.
The challenges in this case were that she had this knock-knee deformity, which was fairly extensive, and what is fairly striking on the x-ray, you can see the difference in the alignment. The left knee has a normal alignment between the femur and the tibia of about 7 degrees, whereas on the right knee it's 30 degrees. In addition, when we look at the lateral x-ray of her knee, we see there's this big soft tissue mass here. This turned out to be a lipoma, which was a benign fatty tumor, and it's tenting up the quadriceps tendon seen here. In addition, this bone that's seen on the front of the femur is heterotopic bone. That's bone that shouldn't be there.
You want to be the healthiest that you can. That's why you go and get your legs fixed, your arm fixed, or whatever it is that needs to be fixed, because you want to live, and you want to live a good life, and you want to be able to do things, and you want the best. And it's been proven to be the best, and they have wonderful temperaments. You know, they're really caring, just great people.
Dr. Buly, and he did a spectacular job. He made it look easy, and suddenly this really complicated, scary looking knee turned out perfect. So he just did a brilliant job.